Hello, welcome to Tuesday Talk with Dr. Sawan. Sorry, I was busy reading my aesthetic journal, trying to update myself on the latest and greatest so we can answer your questions. So, here's an interesting topic that I came by. There's apparently a trend that some people are requesting not to have their belly buttons when they have a tummy tuck, meaning to remove it at the time of the belly button. So, let's talk about belly buttons. Today's talk is about belly buttons. To do or not to do. To have one or not to have one. So where does the belly button come from? Obviously, it's a remnant of the umbilical cord, which we all have when, at birth. And it's a source of nutrition while the baby is growing in the mother's abdomen. And at the time of delivery, they cut it and it becomes redundant, and it's basically a cylinder. The outside of the cylinder is attached to the skin, and the inside is attached to the fascia, which is at the level of the muscle. And at that level, it's a cul-de-sac, unless if somebody develops an umbilical hernia where there's a little protrusion. The shape of the belly button changes from one person to another, but the most aesthetic one is one that looks like an innie. It's not too deep, and it's very well defined, not too broad, and it's usually associated with a nice aesthetic line in the midline just above the belly button. The aesthetic lines of the abdomen, those are the defined line above the belly button as a sign of sort of somebody who's athletic. And the two lines, side lines, and it gives the abdomen more definition, or the tummy more definition. So what happens when somebody develops a hernia? Well, the innie becomes an outie, and they lose that sort of dip. People have different shapes to their tummy or their belly buttons. They can have a really deep innie, they can have a shallow innie, they've had previous surgery there. So what do we typically do during a tummy tuck? Well, we make a cut in the skin but maintain the cylinder attached, and then we bring it out in a new opening, trying and to match the defined or the aesthetic look for the belly button by enhancing its feature, making it smaller and with a nicer shape, and making it an innie. Also, we try and recreate the aesthetic line that's above it. So when you look at somebody's abdomen or tummy after a tummy tuck, or if they're athletic and they work out, there's a nice defined lines on the side and just above the belly button. So whether to have one or not, well, my personal opinion, the belly button has an aesthetic feature if it looks nice, obviously, and not having it makes the canvas totally plain. There's no definition lines, there's no definition. So if it's your choice to have a blank canvas, that's a personal choice, obviously, but there's no defined features or aesthetic features. So I'm going to side with having a belly button, but obviously having a nice defined belly button. So this was today's talk about belly button, to have or not to have, and see you soon with another talk on Tuesday. Thank you.